I'm Dr. Anthony Elias, Professor of Medicine at the University of Colorado, and I'm delighted to present this review of important abstracts presented at ASCO 2021 concerning metastatic breast cancer. I reviewed 3 abstracts regarding estrogen receptor positive disease. 2 regarded the utility and the overall long-term overall survival, looking at fulvestrant with or without a CDK4/6 inhibitor. These were the PALOMA-3 and the MONALEESA-3 trials, respectively looking at palbociclib and ribociclib. Both demonstrated preserved, maintained survival advantage with long-term survival for the metastatic patients. The patients who had less prior therapy, particularly first line, appeared to have greater benefit from the addition of the CDK4/6 inhibitor. I do consider these standard of care at this point, and very few patients, I believe, would not benefit from being given CDK4/6 inhibitors in that setting. The third abstract that I looked at was abstract 12018 regarding the use of acupuncture to ameliorate the achiness and arthralgia from aromatase inhibitors. In this trial, Don Hirschman and collaborators in Southwest Oncology Group demonstrated that true acupuncture provided relief for up to a year compared with sham or delayed acupuncture. I think this is important because this is an extraordinarily common toxicity and is one of the principal reasons for non-compliance with aromatase inhibitor therapy in the adjuvant setting. I then presented 2 abstracts on HER2 positive breast cancer. The first was an interesting trial from China that evaluated in dual positive breast cancer, in other words, HER2 positive, estrogen receptor positive disease, a comparison of endocrine therapy plus trastuzumab versus single agent chemotherapy plus trastuzumab. In this trial, which was designed as a non-inferiority trial, endocrine therapy arm did at least as well as the chemotherapy arm, with a trend towards better survival and progression-free survival, with markedly diminished toxicities. This is in fact contrary to my own bias and might be important. The difficulties with this trial were that there was significant heterogeneity of the patient population, in part that a significant percentage of patients who had prior adjuvant therapy had never received anti-HER2 therapy, and thus are very different than the population we might see in the United States or Europe. The second abstract, which is abstract 1044, looked at the pharmacology of tucatinib and its metabolites in patients with leptomeningeal HER2 positive breast cancer. This is a particularly difficult population to treat, and we essentially have very little to offer except for things like intrathecal Herceptin. In this trial, they were able to demonstrate in 15 patients that the dose and area of under the curve of the tucatinib and its active metabolite is equivalent in the CSF compared to serum. This is quite encouraging, and we look forward to the final results of this phase 2 trial with regard to clinical efficacy in this very difficult to treat population. The final abstract, 1005, regarded a survey of patients with regard to their interests in dose reductions for the management of metastatic disease in order to maximize quality of life. The survey was very well done, and clearly demonstrated that toxicity is probably perceived at a greater rate in patients compared to how physicians view the toxicity, and that patients are extremely interested in trying to reduce this toxicity and improve quality of life. It remains to be seen, however, how we can actually conduct trials to evaluate the potential loss of efficacy with lower doses, as has been seen in certain adjuvant trials over the years. All told, there were many other valuable abstracts which we did not have time to present. Thank you.